Welcome back to our Pediatric Dentist channel Tiny Thick Talks. If you are new to this channel, subscribe the channel, and for details of this channel, visit the bio section, or you can also check out my first video. Sorry if there is any mistake in videos or shorts. Today we will discuss dental age estimation in children. Most important question for both undergrads and postgrads. First, make an index which include introduction, need for dental age estimation, classification, methods and references. Starting with introduction, dental age is estimated according to the last tooth erupted in the oral cavity in normal sequence. There are many other methods to estimate age, but dental development is less affected by environmental factors than skeletal growth and development used in the estimation of age. Also, Rai and Smith found that the dental development is more reliable as an indicator of biological maturity in children that can be used from infancy to late adolescence. Need for dental age estimation. Why we need dental age estimation? To estimate the chronological age of children of unknown birth records and for medico-legal purposes. In cases where children do not have accurate birth records, dental age estimation can provide an approximate chronological age. The treatment planning and the prognosis of certain orthodontic treatments greatly depend on the dental age. Knowing the dental age helps in predicting the outcomes and effectiveness of the treatments, allowing orthodontists to devise more accurate and tailored treatment plans. It can be used a crucial indicator to determine the abnormal eruption sequence so that preventive measures can be implemented. By identifying abnormalities early, dental professionals can implement preventive measures to ensure proper dental health and development, potentially reducing the need for more invasive treatments later on. Coming to the classification, dental age estimation methods can be broadly classified based on the technique used for the determination and based on the age. Based on the methods used, visual, radiographic, chemical, histological. Based on the age estimation in the prenatal period, age estimation in infants, age estimation in children and adolescents, age estimation in adults. First age estimation method based on the technique used is visual. It is based on the sequence of eruption of the teeth. By comparing the observed eruption sequence with the standard eruption chart, the age of the child can be estimated, and the changes that are caused due to functions such as attrition, changes in colors are indicators of aging. As a person ages, the teeth naturally wear down. The degree of attrition can be used as an indicator of age. Teeth can change color over time due to the factors like diet, oral hygiene and aging, and these color changes can be observed and compared to age-related standard. Advantages: non-invasive, quick, cost-effective. Disadvantages: examination may vary between examiners. Second is radiographic. Radiographs of the dentition can be used to determine the stage of the development of the teeth. This method is the most commonly used method as it aids in age determination over a long span of time. Advantages: long span of applicability. This method can be used to estimate age in both children and adult, making it versatile. Non-invasive. Radiographs are a non-invasive technique that does not cause harm to individual, and detailed visualization. Provide detailed images of tooth structure, allowing for accurate assessment. Disadvantages: radiation exposure. Although minimal, there is some exposure to radiation and technical skill required. Accurate interpretation require expertise and variability. Individual variability in dental development due to the genetical and environmental factors. Coming to the third, histological. Histological methods require the preparation of the tissues for detailed microscopic examination, which can determine more accurately the stage of development of dentition. This technique is more appropriate for post-mortem situations. Advantages: high accuracy. Provide precise and detailed information about the developmental stage of the dentition. Detailed examination allows for a comprehensive analysis of the tooth's microstructure. Disadvantages: invasive. These methods require the extraction and destruction of the tooth, making it unsuitable for living individuals. Time consuming. The process of tissue preparation and microscopic examination is labor intensive and time consuming. Require expertise. Accurate interpretation requires specialized knowledge and skill in histology and microscopy. Fourth is physical and chemical analysis. The physical and chemical analysis of dental hard tissues determines alteration in iron levels with age. The advantage is detailed information and non-invasive. Provides detailed information about the chemical composition of teeth. The analysis can be performed performed on the small tooth sample, making it less invasive than other methods. Disadvantages: require specialized equipment and expertise in chemical analysis techniques, and while promising, this method is still in the research stage and not yet widely used in forensic practice. Prenatal and infant age determination. Here how it works. So in early stages of baby's development, both before and after birth, we can accurately estimate their age by looking at their teeth. So baby teeth start forming as early as 2 to 4 months before birth, and the first permanent molars start forming around 6 months before birth. The neonatal line is an optical phenomenon produced due to the alteration in dimension, degree and mineralization of enamel prisms caused due to the sudden change from intrauterine to extrauterine environment, and these lines are present in both enamel and the dentin permanent teeth. This method can be used for assessing the amount of pre and postnatal enamel formation. The estimation of period of survival of an infant in perinatal period using the neonatal line as a line of reference can give the exact age of the babies in days. In primary enamel, rate of enamel formation is 2.5 to 4.5 micro per day. Now, the neonatal line is like a birth marker in teeth. It forms due to the big change when the baby is born and moves from inside the womb to the outside world. The line appears in the enamel and dentin of the teeth. So this is the neonatal line. This brown. By looking at this line, we can see how much enamel was formed before and after birth. These help us estimate the baby's exact age in days. So the teeth grow a tiny bit every day, creating line called the cross striation. This is the cross striation. By counting these lines from the neonatal line, we can find out the baby's age in days. This is the neonatal line, and from these, counting the striation. Cross striation are fine microscopic lines that run across enamel rods, and they represent the daily incremental growth of enamel, showing the daily rate of the enamel deposition. So these are the enamel rods, this big one. These are cross striation, and this is the neonatal line. So from neonatal line, we can count this cross striation and estimate the age of babies in days. So these cross striation are seen across enamel rod, representing the daily incremental deposition of enamel, and this can be used to find the exact age of the babies in days by counting the cross striation from the neonatal line. Neonatal lines can be used to differentiate between live birth and stillbirth, and is an important tool in forensic cases for pre-epidemiology studies, but it has limitations. A couple of days of survival are necessary for the neonatal line to develop. The baby needs to survive a few days after birth for the neonatal line to form. The detection of the neonatal line depends on the various factors like axis of tooth section, thickness of the section, and the light source used. Finding the line depends on how the tooth is cut, how thick the slice is, and the light used to see it. However, the absence of the neonatal line is not always an indicator of stillbirth. If the neonatal line is not present, it doesn't always mean the baby was stillborn. Cross and Jordan method. They studied the early mineralization in various deciduous teeth as well as the permanent first molar. The development is described in 10 stages denoted by Roman numerals from the 1 to 10, and the 9 stage include 3 stages and the 10 stage include the 5 stages. Stages of development. Stage 1, initial mineralization begins. 2, continued mineralization of the tooth crown. 3, further development of the crown. 4, crown formation is nearly complete. 5, root formation starts. 6, root length increases. 7, further root development. 8, root formation continues. 9, this stage has a 3 substage. 9a, initial root completion. 9b, further root completion. 9c, final root formation. And 10, stage 10 has a 5 substage. 10a, initial eruption. 10b, early eruption. 10c, mid eruption. 10d, late eruption, and 10e, complete eruption. Stack method. This method measures the dry weight of the mineralized tooth cusp and give an approximate age of the child. At the 6-month intrauterine life, the weight is 60 mg. In the newborn child, the teeth weight is 0.5 gram, which increases to 1.8 gram after 6 months. The procedures: sample collection. Teeth are collected from the child, typically post-mortem, for analysis. Cleaning and drying. The collected teeth are thoroughly cleaned to remove any debris or extraneous material. Then they dried and remove any moisture moisture content. Weighing: the dry weight of the mineralized cusp of the teeth is measured using a highly sensitive balance. Advantage is non-invasive. Once the teeth are collected, the method does not require any further invasive procedure. Simple and cost-effective. The weighing process is straightforward and does not require complex equipment. Disadvantage is post-mortem requirement and accuracy. The method is typically used post-mortem, making it less applicable for living individuals. While useful, the other method may not be as accurate at other more advanced technique like radiographic or histological method. Each of these methods has its own specification and the choice depends on the requirement of the study. In next part, we will discuss the other methods used in children and adolescents. These are references. If you want this PDF or any other PDF, just like, subscribe and comment your mail ID with the topic and I'll send you the PDF. New videos on Thursday and Sunday. Also, we try to put MCQs according to topic on our shorts with the answers and explanation if needed, which will help you in Viva or NEET exam. Like, share and subscribe the channel. Thank you.